Oops. Oh my gosh. I'm not even wearing my wristwatch. This is 11:22. What is it? Why are you telling me to sign in? Yes, I think this is okay. Alright guys, so this is me getting ready for an online interview. Yes, this interview was actually supposed to be held right at their office this afternoon at 12 noon. But then they gave me an option to choose to have it at home, online, or to come to their office. I was actually prepared to go to their office to have this interview because it's just there on our high street. You know, this is I think it's a mental health or something like that, healthcare assistant. You know, but why I changed having it at home is because my little one, today is Friday. This is Friday afternoon, 11:24. My interview, oh my God, I'm starting in a couple of minutes. It's 12 o'clock, but I have to, log on to the link they sent me about 7 minutes or 8 minutes to the time, though they said 12 o'clock. But then when preparing for an interview, assuming I was to go to their office, definitely I should be there. Let's say 11:45 or 11:30. So when going for an interview, make sure you are there on time. Don't rush into an interview venue. Probably you are running late. You'll be tensed and you wouldn't be composed, especially when you are late to an interview. It happens when you are late to an exam venue or to an exam. You would even forget all that you have read. You'll be tense to concentrate. So definitely I'll be logging on to the link they sent me. Now, why I didn't go to their offices, because yesterday being Thursday, my boy woke up. In fact, my boy greeted me yesterday's morning with sickness. He woke up yesterday's morning rushing to the bathroom. I was really surprised because I didn't wake him up. Usually I wake up 6:40. Yes, I had already woken up, and I did my morning devotion, and I had my boy running to the toilet. What did he do? He was there doing So he woke up being sick. He vomited all through yesterday. I rang the school. The school asked that he stays home. Definitely I wasn't going to take him to school yesterday. Today the school is on school trip, and when a child has something that is suspected to be stomach bug, it is advised that that child stays away from school within 42 hours. That's 2 days interval. Though they say there's a bug going around the school and blah, blah, blah. That notwithstanding, I didn't plan letting him go on the school trip today because he usually has motion sickness as well. Though the school usually prepare for him for that. So yesterday was really a catastrophic day for me and Samto at home. My little boy, having to take care of him. He had he had a lot of episodes, about 5 episodes of vomiting. And in this very country, like I checked online yesterday, what you don't want to do is to go to urgent care. Take your child to an urgent care in the hospital. You have to sit there for hours. That's something I do not want to do because I've had that experience in the past. So when I checked it online, when your child is vomiting, how many episodes of vomiting should your child have for you to take the child to the hospital? Or how long must your child be sick, be vomiting before you take the child to the hospital? What I saw was 24 hours. If within 24 hours the child did not stop, you can take the child to the hospital. So I decided to manage him at home yesterday. So I actually ran to inform the dad, who is still on his holiday per se. He's actually there for a training, advanced training. I rang him. He also gave me his advice. So something was really okay, doing some water little by little, sip by sip. When your child is vomiting, just give plain water. Give the child plain water, 5 ml. Sorry, I'm not a doctor. Please ask your doctor. But from what I saw and what I was advised to do, I was given just ordinary water, not sweetened water, 5 ml, 10 ml. Those ones was able to digest, but food was not staying in his stomach. So I stopped giving him food. Actually, my boy had food this morning. I made him concoctious rice. Yes, the African concoctious rice. Just plain white rice, but I added olive oil and a bit of red oil, our scent leaf, Pepe, little Pepe, that was all he had eaten since yesterday. So we've been home. So this is the reason I'm not going to their office for this very interview. I chose to be home to do this, So I got all my stuff ready. I got my passport and I got my NI, which has expired on the 30th. Honestly, I got tired of them calling me for this interview because they wrote me to say, send in your CV again. I actually applied for this job in July. Yes, when I still have a validity in my BRP. Yeah, that's my NI, because our NI expired on the 30th of August, So that was when I applied. And meanwhile, I was invited over. I went to their office. I told the manager, look, this is my status. Yes, I think it is almost running out, and we have already gone to do biometrics capturing in Newcastle, but it has not come. I think he was a little bit hesitant. Hey, Oyibo. Sorry, I think I saw a little bit of hesitation in him, giving me the opportunity to work for them, though they are quite new. Yes, they wouldn't want to get into trouble. But I was surprised seeing their calls as at last weekend when they called me, yes, to confirm if actually changing blah blah. I said yes. They said send my updated CV, of which I sent them my CV again. They also said I should send my rights to work in the UK and blah blah. I didn't reply that message. Yes, because sending my right to work in the UK means sending this very thing, which it has expired. I didn't want to talk about it because honestly speaking, I am fed up doing healthcare job, especially as a healthcare assistant. It's not a bad job. It's currently a skilled workers. It's currently included in the skilled jobs in the UK. But that notwithstanding, look at me now. Honestly, what I desire doing now is an office work, at least where I could dress corporately, wear my coin, carry them Gucci bags. I needed an office job. But then I've got to do this. Never say never. Yes. Even there was this agency I've been working for, the one I told you guys that I had to spend £20 on transportation going and £20 coming back, and they paid just 120. They've been calling me because I'm already employed. Maybe they don't check to see if I am still, if this thing is still valid for me to work in the UK. So they've been ringing me, but I've told them that I cannot go there again. Yes, they rang me last week if I'm ready to cover that shift again. I said, sorry, I can't go there. I know I don't have a job. But to be frank, I like to do things the right way. So fingers crossed, if they interview me today, wish me good luck. Wish me good luck now so that I'll pass this interview. Yes. Hence it's a part-time, and it's an agency, because working with an agency or working for an agency enables you to choose your shift. When they call you, you cannot work. You simply tell them that you're not available to cover the shift. That's one thing with being independent in the UK, especially when you have children. You have to consider who takes care of the child. If I should find an office work that they should enable me start from 9:30 a.m. in the morning and then finish my shift 2:30, to be honest, especially if it is windy, where I can easily come back, rush to get my boy from school at 3 o'clock, I'll be so thankful, guys. Please wish me luck. I have everything. I have our tenancy agreement, because sometimes when you are doing an interview, they might ask to see the originals of this. I have my council tax here. Our council tax, is in my husband's name and in my name. Tenancy agreement. All these things are proof of address. This is what they will ask for, proof of address. Even after they ask you to show them all this, they will still want you to bring them along so that they can scan and have copies of them, or they ask you to send the scanned copies of your documents, so it is also necessary when doing a virtual interview, you bring out all this in case they ask you. And guess what? I don't even know how it's going to be, but I'm going to be honest to them. I'm still going to remind them, maybe right at the end of the interview, yes, when I might have passed. By the time they say congratulations, Chi, you have passed this interview, that might be when I'll open up and tell them again. Not open up, I'll have to remind them again. We are still waiting for our visa. Meanwhile, the Home Office wrote us, oh my God, look at the time. The Home Office, they wrote us last 2 weeks to apologize for the delay in sending our visas. It's not even our first. They were requesting for head surcharge, 1,400 something pounds. And guess what? Nothing is free in this very country. When you hear free, or the lie, nothing is free. We were just surprised, Then my husband took the letter we got from the Home Office to his employer, which is an NHS trust here, NHS. Do you know what? It was the hospital that paid the money, not even us. Head surcharge. And they said health workers do not pay for head surcharge in this country. Nothing is free in this country, to be frank. Nothing. We were shocked to see that letter. So it stands to reason that even health workers, they get charged, but it is their employers that pay the money, not directly from their pockets. Ladies and gentlemen, I have to end this video here now. Please wish me success. Maybe I might tell you the outcome, because I have about 25 minutes to go, so that I'll start logging in. Yes, talk to you towards the end of this, or at the end of this interview. Bye for now.
A few moments later.
Oh boy, guys, this interview, what is the time? 12:28. That means if we started 11:55, yes, I already logged in 15 minutes to the time, and I was waiting. Imagine. So we spent around 32 minutes when a Nigerian interviews you. This is my first time a black person would interview me, and a Nigerian, from her accent and her name, Oh my God, it's a whole lot. If I should ask me all the questions on earth, all the healthcare assistant interview questions, even the one I've never asked before, what kind of, what did you not like about your job, about providing care to the service? Can you define whistleblowing? What can you say about whistleblowing? Hey, a whole lot of questions, And at the end, she said they will get back to me. Hey, this kind of Igbo, they will get back to you. But definitely, she was enjoying my yarnings, to be frank, because I was giving her practical instances based on my experience working as a support worker. She enjoyed that. Some of them are saying like this and writing. I say, I got you. Guys, I didn't use your channel me. But then, the most fantastic thing is that she didn't even ask me about. And at the end of the interview, she asked me, how soon am I able to resume with them? I said, immediately. He said, am I on student visa? I said, no, depend. I said, so you can work as many as. I said, let me confess, I can only work opposite of my husband's rota, so it's part-time. Well, let me be honest, So that was it, and she thanked me for coming for the interview, but it took longer. Oyibo will only spend 5 to 10 minutes with you. In fact, let us 15 minutes interviewing you. Once you answer 2-3 questions, okay, they don't conclude. But this woman, she honestly asked me everything she had on her list. Guys, I am happy she didn't ask me this. Pray for me that today, the week has already ended, Friday. Pray for me that today, I still stand a chance of getting a letter that our visa has been issued. Yes, so that I can have a renewal of this, okay, or even next week. Thank you for spending time with me. I sincerely appreciate and wish all of you good luck, those that are preparing for one interview or the other. Bye for now.